All right, here we go again. Now we'll go over the surgery, the pain, the pin, and things I wish I knew. The surgery I had was the Scapholunate Ligament Reconstruction with the Arthrex SwiveLock SL Anchor with tendon graft and internal bracing. I think. More or less, that's what it was. I'll put a link to that. They have a couple videos from the manufacturer, which are pretty informative. Basically, a tendon is taken from somewhere else. In my case, I have two of the palmaris longus tendons. I guess about 70% of the population have two, if I understood that correctly. You get different numbers. Either way, that was the one used in my reconstruction. So that was harvested here on the underside of my wrist. Then they sliced me open up top, cleaned out 12 years of scar tissue, drilled some holes, sewed an internal brace to the tendon, basically a tape into the tendon like a cloth, and screwed it in place. Stuck a pin through my bones to internally fixate my wrist so I couldn't move it while it healed. And as for the anesthesia, I had a local block with conscious sedation. I don't know if it was Versed and fentanyl or propofol or some combination thereof. Coming out of sedation was fine, and the local block was really odd. Just a dead arm, no feeling, no control. Now, me being me, I didn't want to have that block last through my bedtime. I wanted to be able to control my arm while I slept. So my surgery was the first case in the morning, and I was home by lunch. I was on the treadmill a few times that afternoon after getting home to metabolize that lido out of the block. This is where I made my first mistake. When the feeling started to come back, I should have taken two of the oxys, or 5 milligrams, and a Tylenol, make my own Percocets, because one 5 milligram oxy was not enough. By the time the block fully wore off that night, I was paying back the pain debt. I was shaking in pain. Convulsing might be a little too much to describe it, but it wasn't great. It was a solid 8 to 10 on the pain scale. I mentioned the pin. Oh, the pin. In the first video, I mentioned that I had a bilateral inguinal hernia repair. I mentioned that here because in that surgery, they dinged my femoral nerve. For about 2 to 3 weeks while walking or hobbling, I would get this nerve pain that would run down my right quad from the groin to the knee. It would stop me in my tracks, and it felt like a blowtorch was being held against my skin in my quad. Thankfully, that subsided. But now I have a 2-inch strip of numbness that goes from the groin to the knee. Still there, it's never gotten any better. But that's better than getting blowtorched. I say all that because the pin used to fixate the bones sits right at the base of the thumb and made my radial nerve very unhappy. Once the generalized pain had subsided, I was left with this searing focal pain right at the base of my thumb where that pin was. Now, I couldn't see anything at first. I had the dressing in place with the brace all ace wrapped up. But the next day, it was excruciating. Nothing else really hurt all that much, actually, but the pin at the base of the thumb just killed me. Killed me now. It was bad. I was like, just kill me. It was awful. Trying to sleep with that was horrible. I was on 2 oxys, alternating Tylenol and ibuprofen for the next week. Ice didn't do shit through the dressing. My arm was elevated nonstop. I was basically elevated for the next few months. Elbow up, hand up. If it wasn't above my shoulder, my hand was always pointing up. At one point, I was worried I had some sort of pressure injury. This is in the first couple of weeks, first week or so. And at that point, I didn't know really that I had a pin in there. I assumed I might have the pin in there, but I wasn't sure. They brought me in at one point because of the pain, and they redressed it, took a look at it, and nothing at all. But oh my, looked fine externally. But I had to start loosening that dressing at night. At times it was so bad. It was like a 10 out of 10. Like, it felt like the pin was burrowing through the skin, right through the nerve. So I dealt with that for about 2 weeks. Then I got put into a fitted brace. And that, when they did that, they flared out the area at the base of my thumb at the radial nerve, just enough to give me some relief, and that was a godsend. That fitted brace was a lifesaver. That pin hurt to some degree for the rest of the recovery and is an area that still bothers me now, about a year out. It's not nerve pain, but it's definitely an area that aches more than other areas. It definitely reminds me that I had a pin stuck in there for 2 months. Hand movement, they'll tell you to move your fingers as much as you can to keep them from developing contractures, keep the tendons loose, and keep them from shortening up. My fingers were moving nonstop during all waking hours, and that didn't stop after the brace came off. 2 months later, I just added more and more movement to keep improving range of motion as best I could. And you could feel the shortness in those tendons when the brace came off. Elevation, my hand was always pointed up. I even rigged it so I would sleep with my hand on an incline. Anything to keep the swelling down and pain off the pin site. Keeping the blood flowing, movement, elevation, that was the goal. It brings me to the few times I would lower my hand, it would turn maroon or even purplish color. This became more noticeable after a month or so. I would notice a tingling in the hand, especially from the pin site. Maybe it was just the blood flow, but of course I started researching studies of scapholunate post-surgical complications and came across CRPS. That's complex regional pain syndrome, and lots of the same symptoms. So there was some panic, we'll say. I asked them about it, and they said everything I was describing sounded normal, and treatment was just physical therapy and steroids if it was that. Well, with the diabetes, I can't do steroids, so I just continued with the movement elevation, just trying to stay as active and keep the blood flowing as much as I could. I'd even walk stairs. I walked a lot of stairs anyways, but I'd walk stairs with my little gimpy hand and raising my arm up and down like I was pumping a baton in a marching band. Anything to do to keep that arm as active as I could while not being able to use half of it. I think some of the other stuff that worried me with the CRPS stuff um, was the discoloration with putting my arm down. It would swell, and the altered sensation. And my hair was also growing in real dark and thick. I realized, and I also read that the hair, at least, was due to the increased blood flow during the healing process. That lasted for a few months. I ended up keeping that forearm shape for a few months after getting the brace off, so I could tape it. More on that later, but all that stressing was for naught, as that was not what was happening. But I had no idea how intense the healing process was going to be. I was completely unprepared for the post-surgical period. I very much underestimated it. I have some background in like post-open heart surgeries and whatnot, and the amount of pain medication they don't need is surprising. It's just bones, and I did not anticipate a couple of holes drilled through my wrist bones was going to be so hard to recover from. The immobility of it really takes its toll. So now hopefully you don't have any of these and you have an easy and fairly painless recovery. But you know what I went through. The next video will be going off more when the brace came off and I started physical therapy with hand therapy.